This exercise has been commissioned with the support of UNFPA. The experts at the United Nations also wish to have had some comments on the delivery, and it took some time. It was over the Christmas period for all those things to come in and to more or less assemble the gains from the December meeting, the myriad gains from the Grenadian stakeholders. It did it did require an extension in terms of the deadline for delivery. So I can tell you that what I've delivered today is a major improvement over what would have been delivered back in December, early December. And I think coming out of this consultation, now that we are back with a cleaner version of the document, with the document benefiting from the expertise of our UN colleagues and so on, I think we are in a better place now to incorporate any comments that would come from today's deliberation. And it is our hope that the document should be available by the end of this month. End of the day, the population policy is going to be owned by the government and the people of Grenada. And many of the people who are here today are people who I would have interviewed and interviewed because they represent important stakeholder groups that are critical in terms of meeting and ensuring that the institutional, the social, the cultural, the economic, and the environmental imperatives of any population policy and the actions associated with those policies, these people are important and critical to achieving those. And they are present here not only because they have contributed initially to providing valuable data to the process, but also as a means of verifying and validating, what has been made of the data that they have provided, and to gain their buy-in to the process, because it's one thing Dr. St. Bernard working on the population policy, but and of course with support from the United Nations, but at the end of the day, it's primarily a Grenada population policy, and they have to endorse everything that is in it insofar as they would have had an input.